How do you treat your kidneys well? You give it the proper human diet. What will destroy your kidneys is not red meat, but type 2 diabetes or type 1 diabetes. Type 1 diabetes cannot be reversed with the carnivore diet, but it can absolutely made better. If you check out my testimonial playlist on my YouTube channel, video L11 and L13, I've interviewed two type 1 diabetics who managed to cut their insulin use by 65%. So some type 2 diabetics are also insulin dependent, so they use insulin. But my doctors say that if your pancreas is still functioning even a little bit, we can still help you to increase your pancreatic function. So type 2 diabetes can absolutely be reversed with the carnivore diet. We do it very quickly. We do it even within 7 days. We do it within 18 days. The longest that it took us was 4 months, but the person was quite sick. Of course, discuss it with your doctor. You have to make informed decisions together with your doctor, and he has to help you to reduce your medicine as it is necessary and as you start to heal. Diabetics also become insulin resistant. Type 1 diabetics also become insulin resistant. So if you get rid of insulin resistance, then your body will work, your body functions will be better, your metabolic health will be better, your energy levels will be better. Some type 1 diabetics have different goals to other type 1 diabetics. For instance, in video L11, Adrian, there's two Adrians on my testimonial playlist on my YouTube channel. That is type 1 diabetic. As it happened to be, both their names are Adrian. But the first Adrian, he actually wanted to gain weight. And he managed to do that. He wanted to gain muscle weight, and he managed to do that. The second Adrian managed to cut weight. He needed to cut weight. I remember he did have hypertension. It's gone because of the carnivore diet. So there are many other things that you might also struggle with, like hypertension perhaps, that you will reverse with the carnivore diet. But check out these videos. You can absolutely do it. The one Adrian saved 2,300 Rand per month by cutting out 65% of his insulin by doing the carnivore diet. Check it out. You must have at least 30% kidney. So you must have at least 30% kidney function before you can do the carnivore diet. I've got two kidney specialists that supports the carnivore diet. And you know, this myth that say you can't eat red meat or you should not eat too much red meat, it will be bad for your kidneys, is nonsense. There's no scientific proof for that. What is true is if you have very little kidney function left, with other words, if you are stage 4 and 5 kidney failure, with other words, more than 30% kidney or less than 30% kidney function left, then you will struggle to do the carnivore diet, because yes, meat does have proteins, and the proteins will be a little bit hard on the kidneys. But what is the cause of kidney disease? In most cases, it is diabetes. Type 1 or type 2 diabetes damage the kidneys. So it's not the red meat's fault. And of course, type 1 diabetics, it's not their fault. But what I say is type 1 diabetics can be improved, or type 1 diabetes can be improved. Go and listen to both Adrian's testimonies. And I'm going to interview the first Adrian, L11, on my testimonial playlist again in the next year. I'm going to interview him again with an update. Yeah. So, yeah, the other thing that will destroy your kidneys is hypertension. And hypertension destroys the membrane of the kidneys. So a high seed oil diet causes you to be inflamed. Don't eat unsaturated seed oil such as canola and sunflower. Don't eat in a high carbohydrate fashion. I always tell this story and it's a true story. I grew up with children, and their father passed away, and he suffered from diabetes. His second wife was a nurse. They were married for 18 years. She gave him the correct medication. I visited her afterwards. Unfortunately, I did not before. It's very unfortunate. But anyway, and her husband suffered. He lost his leg for amputation. His kidneys failed, and he died of heart disease. And she looked well after him. She cared for him. She tried her best. She gave him the correct medication. But why did he still suffer? So I asked her, what are you giving diabetics to eat? And she said, a lot of fruit, a lot of vegetables with a lot of fiber in it. And she was trained in diabetes. She had a special certificate to help diabetics. And yet she buried her own husband, and he suffered. And the children are mad because they think that she did not look after him well. She did. So it's easy to reverse type 2 diabetes because you can just stop eating. If you stop eating, your blood sugar go below 6.5. But the fact is, you cannot stop eating. You have to eat something, right? So the problem is, most of the other diets that claim to reverse the type 2 diabetes, like the vegan diet, for instance, there's a special kind of vegan diet that you can follow. And then you can also reverse the type 2 diabetes, but it takes longer. But what they do is they cut out all seed oils. With other words, they are not taking any fats in at all. And then they eat in a very low carbohydrate fashion. They cut out high carbohydrate fruits and vegetables. But the problem with that is it's not sustainable, because you need nutrients. You have to eat something. And of course, you'll become diabetic again. Now, what makes the carnivore diet different than any other type of diet, it's sustainable. I'm 4 years on the carnivore diet. There's people on my blog. If you click the photo profile, you'll find my blog link, carnivoreway.blogspot.com, who has been doing the carnivore diet for more than 12 years. As always, discuss it with your doctor. Make an informed decision. Type 1 diabetes can be made better with the carnivore diet. You will be able to cut your insulin use by 65%. If you do the carnivore diet correctly, check out my frequently asked question playlist on my YouTube channel, where I answer other questions that you may have. Just to answer your question about the insulin spike or the sugar spikes, your blood sugar will become stable. All these people that I've interviewed 5 type 2 diabetics and 2 type 1 diabetics. All their insulin and their blood sugar levels stabilized. So you'll get stable blood sugar. It will become normal very, very quickly. But you have to discuss it with your doctor and reduce your medicines as it needs to be reduced.